What can you do while you're still young to help prevent any kind of pelvic floor issues, whether it be urinary leakage, bowel leakage, or pelvic organ prolapse? This is a question I get all the time from my young patients, from friends, family, pretty much anybody who knows what I do for a living. Maybe they're thinking about pregnancy or currently pregnant or just had a baby and they're starting to see symptoms of urinary leakage here and there, maybe a little bit of anatomical changes, maybe some perineal laxity. So, they're concerned because they know that their mom had urinary leakage or maybe their grandmother had pelvic organ prolapse and they really want to avoid developing these things, right? So today I'm going to talk about 5 things that you can do now to help improve your pelvic health and hopefully avoid developing pelvic floor issues in the future. Number 1, avoid chronic constipation. So if you're somebody who is straining all the time to have a bowel movement or are not regular, make sure you're taking your fibers adequately. The recommendations are to do 25 to 30 grams of fibers every day. Take the fibers with a lot of water. Otherwise, fibers can have the opposite effect, meaning they can make you even more constipated. And if you have tried some of these dietary changes and you're still constipated, make sure to see a GI specialist to address any underlying issues. If you're somebody who is 45 and above, also make sure that you're up to date on your colonoscopy to rule out any colonic pathology. Number 2, avoid chronic cough. So if you're an asthmatic or you have allergies or you have any kind of COPD or emphysema where you're coughing all the time, so just like constipation, that chronic cough can put a lot of pressure on your pelvic floor muscles and hence cause problems for your pelvic floor issues in the future. Number 3, weight loss. Yes, obesity is a big risk factor for all pelvic floor issues, whether it be urinary leakage, bowel leakage, pelvic organ prolapse. Number 4, stop smoking. If I could only show you what smoking does to the tissue quality, as a surgeon, I see this all the time. It can really affect the connective tissue and can really affect the strength of the pelvic floor. And finally, number 5, Kegels. Yes, everybody's favorite. Do your Kegel exercises. Kegel exercises can help improve the strength of your pelvic floor muscles. The important thing to remember, though, is to do your pelvic floor exercises correctly. And a lot of the times, I think patients, even though they feel that they're doing their Kegels, they're not doing it right. And that's where, things can get tricky.